Well, I always had the ambition to be in the, can say, to be a part of the medical fraternity since I was a child. Whenever I used to visit our family physician, the kind of books which were there on his table always inspired me to, to study and, to get involved in medicine. But as life had it, I couldn't get into medical college, and I even tried to get into computer science, doing my bachelor's in computer science. But again, I was there on the waiting list, and then I chanced upon ad in the Competition Success magazine, which called out for for BSc nursing students. And I think there's something which sparked in me a kind of I felt a thrill that possibly I could get into this course and maybe be as close to the profession that I wanted to be. And at that point of time, I didn't have any colleges which I could enroll in Goa, which was my native place, and hence I moved to Bangalore, where I pursued my BSc in nursing. And that started off a very inspiring and I would say roller coaster ride for me as a nurse, wherein I started as a bedside nurse and went on to be a clinical instructor come tutor. Then I went ahead and do my master's, and I joined in hospital administration with taking varied roles and getting into various, I would say, challenging roles as assistant matron at that point of time when I joined this current organization. And it has inspired me to look into nursing frontiers in a different light, with day-to-day challenges, having many young nurses or the elder nurses to be working with, to get certain inputs from their journey, their experience. I think, and that is what has been my pillar of strength, my guiding light. Go ahead with this profession. And I think that has been still, it's something which gets me out of bed every morning to come to work and have a very satisfied day at the end of the hours that I put in the hospital. So, and again, with the kind of changes which healthcare is coming up now, and it's a never-ending journey, I would say, for a nurse. So it's quite satisfying professionally as well. Well, I think nurses initially were identified to be just at the patient bedside. That was our core of nursing. But over the period of years, I would say, with super specialties coming in and the medical advancements which are coming in healthcare, nurses have also been given the opportunity to get into specialization per se. So you have nurses not at the bedside just as caregivers at the bedside, but now you have nurses working in intensive care units, which are manned with high-tech equipment. You have ventilators, you have the CRRT machines, you have ECMOs, and these are all being manned by nurses. Coming to these, technological age now, where we are in, trying to go paperless. You have everywhere informatics coming in, or you have this, I would say, telemedicine coming in. Nurses have very, very varied roles to play in these kind of situations. Super specialties like transplants, you have liver transplants, you have a bone marrow transplant, you have various specializations like just in critical care, you may have a transplant nurse who is exclusively taking care of this transplant patient. With advancement like in radiotherapy, you have PET scans. So nurses are venturing into these high-tech areas, or these critical care areas, just not with their knowledge, but they are upskilling, they are getting into advancement, they are training themselves. So you just don't have a very, you just don't say that nurse's role is just limited to the bedside. It can expand to not only critical care. You have nurses getting into research, you have nurses getting into being clinical specialists, you have even nurses becoming the CEO of hospitals. So the sky is the limit for any nurse, for that matter, who wants to get into this profession. I think sky is the limit. You can go into any field that you want. Right. So I would say a novice nurse who comes into the hospital, she will be recruited with the proper recruitment system. You'll have their credentials checked. You'll have their educational background checked. There'll be a brief interview, which just not just tests your knowledge, but also your attitude and aptitude towards the profession. Once the nurse is selected, assigned particular area, maybe because of the willingness that they want to work in that particular area, or depending upon the kind of thought process this young nurse may have, she undergoes rather a proper hospital induction program, as well as a departmental orientation program, wherein he or she is entitled to follow protocols, entitled to learn what are the basic functional training that they would require to do that particular job in that particular department. Other than that, nurses would also get into in-depth training of the kind of equipments they would want to use. They would need the kind of knowledge they would require to handle this kind of patients. For that, departmental trainings happen. Sometimes they have been also sent to other areas for specialized trainings. And then you have your, yearly appraisals, where you understand what is the nurse capable of. And you have young budding nurses who are so enthusiastic, who are just so driven for, or passionate about their profession, that you don't just want to limit with only experience and then give her that role. You would want to say, all right, this girl or this young person is wanting to take up that role. You would always want to give it to her, provided you give her a mentor, ensure that she gets the necessary knowledge and skill, and you upskill that nurse. So at MGM, we have this system which is being followed. Gradually, you have nurses who are team leaders, who become shift in charges, who become in charges, later become supervisors. They become specialized nurses in particular units, like the operation theater or a critical care nurse or a BMT nurse. And I think now with super specialization coming in, and in a hospital setup like MGM, where we have various super specialties, I think the training, the knowledge, and the kind of you give the motivation to these young nurses to come up to that level is something very, very important. And that's what we have been doing in, I think the hospital management is very pro for nursing education and upskilling, that there's never been a hassle when, we wanted to get people trained in a particular, I would say, particular equipment like a CRRT that we had, or when we initially went in for liver transplant. So they were very enthused to send nurses, to various other organizations to learn or to get the experience of how to handle such kind of patients. So we have a very strong support system in the management who ensures that we, train our nurses well. With the accreditation backup, like having NABH and JCI also has a very strong foundation in laying down standardized protocols for nurses to follow, wherein there is a robust training which is given to each and every nurse in the hospital, who ensures that proper methodology is followed during patient assessment, patient care, how they will report to the consultant. The nurses are empowered to take certain critical decisions in time of crisis, when they can take the call and inform the consultant and go ahead and manage the patient. We also have started with certain training programs, that we have these nurse practitioner critical care and nurse practitioner in emergency and trauma care, which will be started this current academic year. So by which we are, wanting to train nurses to be nurse practitioners in these critical units like critical care and emergency and trauma, wherein they will be privileged and empowered with certain or I would say skills and experiences where they would go freehand and assess the patient or take up certain critical care calls, or they will probably be in a position to start central lines, intubate a patient, which a normal registered nurse would not be able to do. So there is a lot of advancement in nursing, and we as a hospital has always encouraged nurses to upskill both their knowledge and skills to ensure better patient care and good patient outcomes. A nurse is the center point for every patient who comes to the hospital. You name it, the OPD, or you can say it as a ward or even a critical care unit. She is the one person who's there at the patient bedside 24/7, who provides holistic care to the patient in the sense that she's the one who is doing the assessments, the patient, name it, intake output chart, simple vital signs. She's the one who is always collaborating with the treating consultant, with the various other services like a physiotherapy or a nutritionist or any other service personnel who would be getting in touch with the patient. So she is the foremost person that even a patient or a caregiver would go to. So in this way, nurse just doesn't look at the patient as a patient, but she's also the binding force to ensure that all services are being provided to the patient at the right time with the necessary requirements to ensure the patient gets a good positive outcome or a better outcome. I think this question, if you've been asking any nurse for that matter, the only, and I would say the best satisfying, what I would say, or the satisfaction that you get from your job is to see your patient getting all right and going home. You see, that kind of a positive outcome is something that we look forward to all the patients that we care. But yes, every job has its positives and negatives. Nurses at the bedside, or I would say anywhere in a hospital scenario, face a lot of challenges, namely physical exertion, mental exhaustion, which leads to burnout, stress levels going high. You are working in a multidisciplinary team, where you will get orders left, right, center. You have to collaborate with a lot of professionals. You have to prioritize what the patient will require at what given point of time. You need to be on your toes and take those critical care decisions when you know your patient is just going downhill and you catch the patient at the nick of time. You need to be active. You need to be, always professionally sound whenever you encounter any clinical or you take out any clinical decisions. So other than this, I think the long working hours, you don't have a time that you may say, okay, my shift is done and I may go home. You may need to stay back if there was a cold blue of your patient and you need to resuscitate or you need to shift the patient to an ICU and so forth. So these kind of challenges can definitely have a negative impact on the nurse's health. Sometimes we don't prioritize ourselves. We say, oh, it's all right if I don't take a loo break. It's all right if I have not had a glass of water, or I forgo my lunch or that small kind of tea break that I have, thinking I have so much things to do on my plate and I need to complete that task before I go to take care of myself or herself. So that may lead to a lot of physical exhaustion, even mental, I would say, clouding, wherein you are not clear-headed at that point of time. So this can have adverse effects. You may make mistakes. You may, forget to give a very important, what you can say, maybe a medicine, or you may forget to give that critical call to the consultant. So these things again add into your work pressures, again increase your stress level, and could be these certain things could be avoided, but many times we prefer to give our tasks at hand more priority and importance than ourselves. I think this gives us a lot of challenging times at work. Yes, as we say, health is not only physical health, but it's also your mental health, which is also very important. So when we know that nursing is emotionally draining, kind of the kind of patients that we handle, when we listen to their worries, their stresses, their tensions, the family probably may just break down in front of you. So it gives you a lot of emotional stress, and maybe sometimes these young shoulders will not be able to handle such kind of an emotional I would say outburst. So that is the time that we should consider giving ourselves a priority. Sometimes prioritizing ourselves is not, I would say, a negative concept that you can think, but giving yourself a chance, saying that, all right, I need that loo break. Delegate your responsibilities to some of your colleagues around, take that loo break. You need to have a sip of water, go have it. You are emotionally overwhelmed. It's important that you speak to someone. You may have a mentor, you may need to go and speak to the psychologist. Why not? Doesn't mean that people will look at you with a different lens or a different concept, but no, that's secondary. Important is that you take care of your well-being. When you go back home, I think having I know professional and personal life has a very thin line, but it's important to break. I'm going to have a defined timeline or defined, I would say, thought process when I'm professionally involved and I'm in it's my private life. So get time to get into those hobbies. For all these years when we had Nurses Day, we had various nurses coming up with beautiful dance. I would say beautiful. We had nurses coming up with their talents like dancing, singing. They participate in role plays. They showcase their talents in cooking or displaying their art and craft works. So try to, what I would say is get into those hobbies when you were a child, you were passionate about. Many times when we see, when in our childhood we were good singers, we used to go for dancing classes, and some people were good artists. But once they come into the profession, they kind of forego all this and go into a very mundane life. So it's time to break off this, get into those passions which will relieve your stress. And that's important. Also, ensuring that you are able to share your burden with someone. If you are hesitant in, sharing with someone, start journaling, writing down, or just bring it out. So it will help you to relieve your stress, relieve your emotions, and that will make you mentally well. And it's important because we have to come the next day, say maybe face the same kind of critical patient that we have, or we can say difficult family members. Important that we come again with a very positive outlook. We are fresh at work, we know what we are doing, and we are able to handle our work pressures effectively. Well, as I had initially said, nurses are the core of healthcare. They are there with your patient 24/7. So just being there for your patient, at that critical time where there would be moments of fear, moments where they feel desperate that no one is around, moments when they are completely down with that sickness that they have, moments when they have no hope. So that is the time nurses are the ones who, give them that additional emotional support. They would speak to the patient, allow him to ventilate, be with them when they are talking to a consultant, provide I would say suggest ways and means how to handle that situation. Nurses are very good patient advocates. They are very good communicators. They have that kind of a skill wherein a patient would never open up to a doctor, but they would freely open up to a nurse. So they have always seen nurses as that one strong pillar of strength in their most, I would say, most critical moments of their life, when they are at that juncture of deciding whether I will probably live or survive or not. So nurses have always been that beacon of hope for many. Other than the patients themselves, you have their family or their caregivers who are equally emotionally disturbed when a patient comes to the hospital, because hospital is not a place that anyone and everyone walks in, until they are faced with a very critical crisis in their family member or in their families. And many a times you see families are lost. They don't know what to do in a hospital, whom to approach, who is a better person to guide them, or where do they go for clarifying their doubts. So nurses become that core center point, wherein they will filter out all your queries. If you ask them, ma'am, could you tell me where this happens, where do I do this particular test, how much will that cost, what will be my length of stay, how do I go ahead for this, they would answer all your queries, not because that they are only knowledgeable, but they will ensure that they get the right information and give to you. So for family members, they become that emotional strong, where the family members are emotionally disturbed, they become their cornerstone of support. So here they just don't provide information, they also ensure that they are there. They counsel patients, they may refer them to a psychologist, or they may refer them to a counselor, wherein their queries are being answered, both for the disease condition, or you may say maybe they are clueless about what the treatment entails, they are clueless about what they will probably need to do at home. So nurses now just not treating the patient, they are also going far ahead. At MGM itself, we are just not treating, we are also into preventive medicine, we are also into promoting good health, improving patients' lifestyle by educating them about prevention measures, how to go ahead to have a good healthy lifestyle. If I have a bedridden patient, we educate patients' relatives how to take care of this patient so that they don't develop pressure injuries or pressure ulcers. We, when you have a patient who has undergone surgery, we teach them about wound care management, how to take care of the patient at home. So we are going beyond the walls of the hospital, just not to ensure that the patient is also well taken care of, but also the family members are also participating in the care of the patient. So it becomes a complete full circle if it comes to both the patient and the family. I think it's very important for nurses to be in leadership roles, because nurses are the ones who are at the bedside. They know your fundamental problems or fundamental issues that you may have in the hospital. They are the ones who are connecting with various caregivers, various consultants, various specialities. So they know your whole hospital in totality. So they are ones who to suggest better decision making. They are ones to suggest better patient care proposals. They are the ones who will advocate what works for us in a hospital or no. And they are also the ones who will probably prompt the management and administration to have strategic ways to look at, or to have strategic planning to come up with better policies and I would say management decisions. So they are important sources for you. So listening to them is important, and as well as nurses, it is important for us to voice out. Unless and until I don't bring my thoughts and the requirements that I have to the topmost level, I think many decisions will not be taken which are imperative for better patient outcomes, or for that matter for a good organization to function. So nurses definitely play a very important role as leaders, and to develop a nurse to be a leader, I think she requires, of course, a training and upskilling herself to understand what are the various methodologies that she or he would need to become a good leader. They would also need probably a certification program to understand various aspects of leadership. It's just not just to look at one area of it, but to have an overall overview of the administration that is required in a hospital. For that, then good knowledge and training is essential. Leaders will always require good mentors, because a lot of experience of a mentor will always be that kind of I would say that link between a young nurse who wants to be a leader. She would always need to be, she would always connect with her mentor and say, all right, I have this kind of a problem, and this is what I'm thinking about it. So the mentor would be that kind of a guide who will translate her experiences and give it to her that, all right, maybe you could try this out, this probably worked for me, you would try a suitable way and help out to work. They also need a good support system. I think at MGM we have a very good support system in our management, who have always encouraged young leaders to take up roles and responsibilities in various sectors that have kind of developed our leadership skills. Also, kind of appreciation and recognition also plays a very, very important role for a young leader, I would say, because that entails that this particular journey is not only going to be a smooth ride, but if you have difficulties or you have roadblocks and you have kind of faced it with that challenge being thrown to you and you have accomplished certain things, definitely it becomes your accomplishment, and recognition follows it, which gives you that kind of a sense of confidence to take up further roles and responsibilities as a leader. I think this year's theme by the International Council of Nurses is very apt. During the pandemic, we have lost many of our nurses or other frontline healthcare workers to the pandemic. The kind of emotional and traumatic experiences that they had. We also saw that many of our healthcare workers had long working hours. They were working 36 hours, 48 hours continuously with no backup, and they were exhausted to the core. These emotional and traumatic experiences, I've also seen a lot of nurses leaving the profession, creating that kind of, I would say, vacuum, wherein young novice nurses have been forced to take up responsibilities wherein they have no experience, and adding into that extra stress to their young lives. So I think it's important now that we take care of our nurses, and for which not only the physical aspect about it, but the mental health, the emotional health, and probably all the aspects of how a healthy person is required to be is what is required for the young nurses today. And with this theme, I think the world is opening up to understand how important nurses are for the healthcare system. Not only, to be just a bedside nurse to take care of the patients and their family or their loved ones, but also to ensure that nurses are healthy in themselves, to be able to handle that kind of a work pressure. In a very, I would say this is a very common scenario that we have. We have probably a nurse on duty just falling sick, not reporting, and then the whole shift is in a turmoil because other nurses have to, share the workload. The burden becomes a burden at that last minute to, not be mentally prepared to take care of this extra workload. And then you have, kind of problems on the floor. You may have patient getting agitated. You may have conflicts and things. I mean, it's a never-ending story. So here it becomes very vital that we stress on the importance of nurses being healthy themselves. So, going back, it goes back to that same point. It's not that we are just physically fit, we are also emotionally and mentally equally fit, so that we can be professionally ready to face up whatever challenges that we get at the workplace. And seeing to this kind of I would say resilient workforce that we would be able to create, it is important that societies at large understand the role of nurses that they play in this healthcare system. So we are just probably one of the strongest workforce that's required to drive these various healthcare policies that I would say our government makers are coming up with. So it's just not to reach to the patient at the healthcare, but to reach to the community at large, to the most interior sectors wherein you may just have one nurse who's taking care of the whole primary health center. So it's important that once a nurse is well-being is taken care of, she can take care of the whole society at large. The theme sums it up, and it's high time that we all, as nurses, or I would say administrators, or being in the healthcare system itself, join our hands together to ensure that our young nurses are uplifted, they are taken care of, they are understood, they are emotionally as well as mentally supported. Well, I would say it's not just now, it has been the go-to profession for decades. But yes, it was underrated. But now with so many openings coming up, and you have various avenues that you could, try if you are not so, you would say, satisfied to be at a bedside nurse. It's important that you have your knowledge, you have your skill sets, and you can try various roles in nursing. I mean, you can be as a bedside nurse, as a registered nurse who goes on to be a super specialized nurse. Now, with nurse practitioners coming up in India, that would be a very lucrative profession to choose, wherein you can try your clinical knowledge and skills to the, to the maximum of your ability. We have nurse researchers who are getting into various forms of research, not just being able to have only the knowledge and practices tested, but now with a lot of innovation coming up, they have these young minds are so talented that they come up with very simple things which probably would have been overlooked over the years, and which definitely have helped in better patient outcomes. If you are an academician, you could get into college, you could be could be a lecturer, or you could be in the hospital as a nurse educator who is motivating young novice nurses with the kind of skills required and grooming them up to be clinically skillful. You could be a nurse administrator, you could be as an in-charge nurse, you could be as a supervisor nurse administrator to the chief of nursing or a director nursing. You could even go up to be the CEO of a hospital. So there's nothing which can stop you from achieving what you wanted to, or you wanted to get into a particular line. The sky is the limit for nursing now. And with the rampant change in healthcare system, with the kind of advancements in technology coming in, I think this is the best time for nurses to be. So you can get into the kind of field that you want to. You can, be professionally as a nurse, but get into being tech savvy, getting into nurse informatics, wherein you design the kind of software that you will feel will be easy for your nurses at the bedside. So there are various roles coming up now, and just being as a fresh graduate nurse is not going to be the final point. You can go up to whatever you would want to achieve. So definitely it's definitely a very good I would say an era for nurses now, and we can do wonders for the healthcare. As we are celebrating the Nurses Day, let's not forget our founder of this nursing profession, Florence Nightingale, who lit the lamp and showed millions of nurses the way to, healthcare system, to develop a very robust healthcare system. So with her as a pioneer, let us move forward, ensure that we grow up to be fantastic, or I would say fabulous nurses, reaching out to every individual across the world, breaking the barriers of culture, I would say religion and race, and meeting or helping our fellow human beings to meet their healthcare needs. And with that, I would say I'm really proud to be a nurse, and I wish every nurse here a very happy Nurses Day. Thank you.